Hey everybody, it's Parker with Dailey Aesthetics and Hormone Clinic. I'm here with one of my patients, Kylie Overman, who did receive the Empower RF treatments. She got the V-Tone and the Morpheus8V. We're just gonna see kind of what her experience was before we kind of dive into the nitty-gritty of it. So Kylie, what symptoms were you having before we started treatment with you?
So I've had 2 children, and since having them, I had some lower back pain from pelvic floor being kind of like looser. I fell during my second pregnancy and kind of tore a muscle in my pelvis. And so I was struggling with urinary incontinence. So I had to always cross my legs when I would sneeze, or could never go on a trampoline, all of those fun things. And then different positions during intercourse would be painful and uncomfortable. And it was honestly harder to enjoy it, which was unfortunate. And so, yeah, it was just a struggle. It's kind of not very fun, not very comfortable.
And did you have vaginal deliveries, or were they, okay?
So they both were vaginal.
Okay. And then so like during the therapy, you know, when we did the V-Tone, that's kind of the more pelvic floor therapy. What were you feeling during that?
That was just like a pulse, kind of. That was, you're just like laying there, and kind of after a couple minutes, you don't really notice it. It's like, when it first started, I was like, oh, just like my body kind of moved just a little bit.
Yeah.
Not uncomfortable, just pulsing, you know?
Yeah.
And then, and it's kind of like you doing your Kegels. It's almost like that feeling, but you're not doing anything. You don't have to move, which is nice.
Yeah.
And then after, like 5 minutes, you're just like, laying there doing nothing.
Yeah.
It's not bad at all.
Pain-free.
Pain-free. Oh yeah. No pain, watching TV, watching my phone, getting some peace and quiet.
Yeah. And you said like after you had your one therapy of the V-Tone, like you sneezed at work and you...
Oh my goodness.
Yeah.
Later that day, literally I was walking and I had to I sneezed and I didn't even think about it. I didn't cross my legs and nothing came out. And I was like, oh my gosh, that's amazing. I had texted you as fast as I could because I was so happy.
Okay, and then we also did like the Morpheus8V, which uses radio frequency inside of the vaginal canal to kind of help promote that tissue rebuild, to help with painful intercourse and dryness. Explain to our viewers what you were feeling during that treatment. It
was like warm, like really hot. Not really hot, but it was just warmth the whole time, basically. You're just moving it back and forth, and it's just warm. It's not tingly, which I thought it would be, but it's not really tingly. I just felt like it was like you had just like a warm rod moving around. Yeah. So it wasn't bad at all.
Okay. No pain with that?
No,
either?
No pain.
Okay.
No pain.
Great. And then with that one, what did you feel you benefited from with that treatment that we did?
Oh, well, I definitely think like my lips got tighter and like smaller, which I didn't, it was insane that I didn't even realize that they could have been tighter. Do you know what I mean? Yeah. And so, and then the other thing is like never having to use any lubricant or anything, which is nice. Like feeling like I had to before, not had to, but it was more comfortable and not even having to reach for it at all, which is very beneficial because it's just nice to not have to do that. Yeah. But yeah, I just felt like it tightened things up internally. Yeah. And then I feel like I've been having less lower back problems and everything feels tighter, don't have to deal with the sneezing, like I said, and then, you know, jumping, like exercising. I don't feel like I have to keep a focus on what's going on down there while exercising because everything is tight. Everything is strong. That's great. Strong is a better word. Yeah, it's very strong.
Well, I like that term.
So yeah, and then like being during intercourse, everything is so much more comfortable, so much less pain, so much like more completion and enjoying.
You had more sensation, didn't you?
Yes, yes, very, So it's been like, and I have like an increase in libido is like way higher. So that's really awesome where I'm like, no, I actually have like a higher sex drive now, which is just beneficial for my marriage. Yeah. But like, it's just nicer to feel those things and enjoy them rather than not.
Right, yeah. And probably with the increase in libido, because you've had the positive experiences with it, and, you know, because it's not as painful anymore, like you were wanting to have more intercourse.
Exactly, which is really nice.
Okay, yeah, that's great. And then so we've done 3 treatments.
Today's our third.
Today's our third. Okay, yeah. And so you would say even after your first treatment.
Oh my gosh, after my first, I noticed a lot.
Yeah.
And I'm a little bit younger and I've had 2 kids, so I feel like everyone's healing is probably different, but it really affected me.
Oh yeah.
So I would say at least 1, but 2, I'm after 2 was definitely even more.
Yeah.
So I'm excited for the 3rd.
I'm excited for the 3rd one too. I'm super excited. Yeah. Well, I think now we're just kind of cut to it. We'll kind of do some of the V-tone and the Forma-V on you, and then we'll kind of ask you, how you're feeling things during those therapies, and then that should be about it for us today.
Perfect.
Yay, thank you so much. Alrighty guys, we'll see you here in a bit. Alrighty guys, we're back. So Kylie, are you ready for your V-tone treatment?
Ready.
Okay, so the V-tone treatment again is, it kind of looks like a little bit of a ring pop. You put it inside the vaginal canal, and then it will cause pelvic floor contractions. So we're gonna start off really low, and then we'll slowly work our way up until it's almost uncomfortable. And then we'll kind of back down just a little bit, and then we'll kind of let you be here for about 30 minutes. But we're gonna show everyone how easy this is, how laid back this is, where you can just kind of come in, receive a 30-minute treatment, be on your phone, watch some Netflix, kind of stuff like that, okay? All right, so we are going to start here. You probably can't feel any of that energy.
Okay. I can't feel it at all. Feel something's going on, but not at all uncomfortable.
Okay.
There, just a little bit more. Maybe we didn't really. I can feel that.
Yeah. Pretty good?
Yeah, that one feels good.
Okay.
I think that's good.
That's good?
Yeah.
Okay. So let us know when it happens and then how long it happens for.
Oh, okay.
Okay.
It's going right now.
Uh-huh.
And now it's done.
Okay. Another time.
Going.
Uh-huh.
And now it's done.
Okay. Yeah. And what does it feel like when you're doing this?
It feels like something's pulsing.
Uh-huh. Like your pelvic floor pulsing?
Yeah. Yeah. Yeah, it's weird because it's not a vibration. It's not hot. It's just like something is kind of maybe expanding a little bit and then contracting back down, but not contracting in an uncomfortable way.
Yeah, great.
So you just feel that it's there and it's throbbing.
Yeah, okay.
But it's not a painful throb.
All right, that's great.
Yeah, it's really easy. I can just lay here.
Yeah. All right, we're gonna let her be here for about 30 minutes, and you can play on your phone, you can watch Netflix, kind of whatever you want, but we'll see you here in about 30 minutes, okay?
Perfect.
Hey everybody, here with Kylie again. So we're gonna do the Forma-V on her. This is kind of the tool of what it looks like. So it has these kind of metal plates on it to help with the radio frequency. That's where the energy comes from. So this actually is done intravaginally, and you kind of do it all over the vaginal wall. So we do put some ultrasound gel on this, and just for comfortability, we do kind of start the procedure so that it kind of heats up the gel so it's a little bit more comfortable for the patient. But yeah, we're gonna get started here, and then we'll just kind of ask Kylie what she's experiencing throughout it, okay?
Sounds good.
All right, I'm gonna keep it covered up.
Okay, sounds good.
All righty.
Giving people a show.
You're gonna feel me touch here. Doing okay? Okay. And then we kind of gonna go towards the end. And then just kind of move the wand backwards and forwards all along the vaginal wall, all the way to the back, all the way to the front. And the beeps mean that we have reached the internal temperature that we have preset. And then how is this feeling?
Good.
Yeah. What does it feel like?
It can kind of like tickle sometimes.
Yeah.
And it just feels like you're moving a wand in and out. It's warm.
Okay. No pain?
No pain.
Okay.
No. It can kind of feel like, it just feels like a little...
Like a wand.
Little wand going, moving around. But yeah, mostly it's just warm. You do have to go to the bathroom before, because if you don't go to the bathroom, I feel like it can make you feel like you need to pee. Yeah,
so we usually do have individuals empty their bladder before they start any of these treatments.
I think some people were asking me, does it like feel good, but it's not like it's feeling good, like sensational, but it doesn't like feel bad.
It's not like it's a sex toy.
Correct, right.
It's very medical.
Right. Like you're definitely getting a medical procedure, but it's not like getting a pap smear, which is uncomfortable. I think that's uncomfortable.
More uncomfortable than this?
Oh, so much more uncomfortable. When they have to put whatever the thing is in there to open up your cervix and stuff, that's uncomfortable. This is nothing compared to that.
Yeah. And so we'll do this like 20 minutes on the outside, and then you can do this externally as well. We'll probably do 10 minutes on each lip. And that will help kind of shrink the tissue, make it look a little bit more, you know, aesthetically pleasing, because we all like that. But yeah, we should be really good to go. We're just gonna do this for, you know, we really want to look at the total energies on this. Because for the total energies is basically, you can do by time, but you really want to make sure that the tissue is actually receiving the energy needed to, you know, strengthen that vaginal wall so you don't have painful intercourse, so everything is a little bit more moisturized. It's going to thicken that vaginal wall so you're not having some spotting during some intercourse, and also definitely help with sensation as well.